100% effective. That's one of the reasons why we do aim for that 95% coverage. The vast majority of people will develop immunity, but there's a very small group who don't. So, but that's well known. The other issue is that although someone might have a breakthrough illness, so they might still get the disease after they've been vaccinated, rarely, but it does happen. Usually that's an attenuated form, so they're much less sick, so there is still that protection. So that's in terms of efficacy. Then in terms of their safety, these vaccines are all trialled extensively, and there's ongoing reporting about instances. So again, no pharmaceutical is 100% safe. Every pharmaceutical will have side effects, and vaccines are no different. But the vast majority of the side effects to vaccines are local ones, so they cause pain at the site of injection, some redness, some swelling. Then far less commonly there are more serious effects. And that's one of the reasons why that Lady Cilento clinic's been set up, to assist people if they do have a more serious side effect and they then need to have that vaccine again, because a lot of vaccines you do need 2 or 3 doses for it to be efficacious, or you need booster shots so they can have that vaccine in a safe, protected environment. So, but I assure you that all vaccines are thoroughly tested. They have to go through the Therapeutic Goods Administration, it has a new name now, I apologise, and the Commonwealth for assessment before they're endorsed and allowed to be used in Australia, and there's a very thorough process there. So that process is well and truly tried and tested.
Thank you very much. Deputy Chair.
Thank you, Dr. Young. I noticed before that one of my colleagues raised about the matter of childcare workers being immunised, so I'm glad that we're looking at addressing that, because I actually did raise that in the private members bill last year. Also, just to clarify again about the previous objections of the committee in the 2013 bill, at that stage provided for objections, whether conscientious or medical, which has now been overturned due to the federal legislation. So I think our stance at the time was because it was state legislation at the time and there was no federal legislation that overruled it. So I just sort of wanted to clarify that, because obviously I spoke to you about that at the time. Can you just elaborate for me about some examples for the non-medical people in the room about what approved medical reasons for not being vaccinated would be? And I think I raised this last time too. My daughter was a super allergy baby, and she did have her vaccinations, but every one of them was done in theatre or in the intensive care unit, and I just waited for the code blue to be called. So can you just give some examples of what severe medical conditions that children would be considered to be exempt from this?
Yeah. You've raised the main one, which is allergic reactions. So that's again why that clinic's been set up, to provide those vaccines in a safe environment. So that's the major one that we work through. As I said before, there are a lot of minor reactions that would not be regarded as reaching that threshold.
Okay, and also Steve Dixon raised about pertussis outbreaks. I think that's a really big issue, because, as you well know, there are a lot of adults wandering around with whooping cough who have no idea that they've got whooping cough. And again, going back to my experience as a parent, my daughter was vaccinated 3 times in 6 years for pertussis and still got pertussis. So is there any view on that?
Yes. Pertussis is not as efficacious a vaccine. The immunity does tend to wane in time, but the most important thing is to protect those babies under 2 months of age, because they can't get vaccinated till they're 6 weeks old, and they're the ones that will die if they get it. So it's an awful disease when older people get it, when adults get it, but they don't usually die from it. But little babies do. And now we've rolled out a program that's been quite successful for pregnant women. So in their 3rd trimester, we're vaccinating them, and that's passing on that immunity to their unborn baby, so that baby's protected for the first 6 weeks. Now, UK did a similar program, which is why we followed, where they had a whole run of deaths. I can't remember now, but I think it was about 10 deaths of little babies, because their population's so much bigger, of course. And they put in the program, and they only had 1 death after that in the evaluation period, and that was in a mother that hadn't been immunised against pertussis, against whooping cough during pregnancy. So a very effective program.
I do remember something similar happening in Victoria in the early 80s, because I was working in the paediatric unit at the time, and there was a child. It was a pretty big case in Victoria, and I don't know exactly what the ratio is for the number of for the patients who are allergic, severely allergic to the pertussis vaccine, but there was a whole raft of babies, newborns effectively, they'd only just been out of hospital and were coming back in, and we had really, really sick babies, and we didn't lose any, but we had this whole rash just because there was one very highly publicised issue of a baby who had been vaccinated and had a reaction.
Yeah.
Thanks.
Thank you. Member Mogul?
Just one final question, Dr. Young. If we weren't to have the current range of vaccines that are available to be utilised, are you aware of any other treatment modalities which are evidence-based which would lead to a reduction in infectious transmissible diseases?
Not one that's as effective as a vaccine. I mean, that is the most effective way of preventing vaccine-preventable diseases.
Thank you.
Thank you very much, Dr. Young, for the fulsomeness of your responses here today. There is one final minute if there was anyone else with you who wanted to make any final statements or comments. I know the Department of Education and Training is here too, but if you're happy. Sorry? I apologise. My colleague, Member for Green Slopes, looks very eager.
If this question to be taken on notice.
Okay.
You mentioned that all medications have the potential for adverse outcomes. Would you be able to give us sort of a percentage of adverse outcomes that might result from the various types of vaccination? I know there's a range of them out there, versus the percentage of mortality rates in populations that weren't vaccinated prior to the introduction of vaccination?
Yes, we could do our best to address that. I think is one best taken on notice because it's quite complicated in terms of the data. Yes, I'm very happy to take that on notice. Thank you.
Thank you. And with that, our time is expired. Thank you so much for attending today, and again for the fulsomeness of your responses. We very much appreciate it. And next we'll be calling the Queensland Nurses Union. Thank you. Thank you.